Yeah, so my name is Dr. Susan Cheruiyot. I'm one of the family medicine doctors at the Aga Khan University Hospital. And I've been invited here to talk a bit about respiratory or acute infections with a focus on respiratory illnesses. So I think this topic is important for us just because of what has been happening the last 5 years with all the respiratory infections that have been going on or have been happening of late, right? So if someone can project my slides, maybe. So as we wait for that to happen, who among us got COVID? In the last 4 years? No one. Okay, my hand is up. So anyone else who got COVID around that time? Okay, anyone who knows anyone who had COVID then? All of us, yeah? Anyone knows somebody who died who got COVID and passed away? We all do, right? What about the flu? I know in the last 1 month we've been talking about, there's this flu going around. Who has gotten a flu in the last 1 month? I know I have. Yeah, right? And so there's been a lot of questions around, how do we prevent these infections? Can the flu cause someone to be admitted in the hospital? Yeah. So what I'll do is I'll give a brief talk about just surrounding, COVID, surrounding in the influenza virus, and then discuss ways of how we can prevent infections or manage ourselves better. And then I'll give you an opportunity to ask questions if you have any. Yeah. So if you go to the first slide. So my outline will be why COVID or why respiratory tract infections. And then I'll talk a bit about the boring stuff, which is now how the virus looks like and how it replicates, boring stuff. And then we'll talk a bit about ways of preventing. And finally, why vaccinate? Is vaccination a myth or is it, is it something that we should be concerned about? So the next slide on COVID prevalence. So in worldwide, we've had around 760 million cases of COVID reported since 2020, right? And we've had a 1% mortality rate. In Kenya, we've had about 300,000 cases of COVID that have been reported in the last, since 2020. So those are 3.5 years, yeah? And of course, this is an underestimation because here in our country, people don't test. Some people passed away, they were buried, and we forgot, and we didn't test them. And out of the documented deaths, it was about 2%. So 2% of the people who got COVID have passed away. And currently, is COVID over? No, it's not. We are still getting reports worldwide. About 300,000 cases were reported in the last 1 week. Next slide. So about COVID, what is it? So the COVID is caused by this virus, yeah? I hope you can see the picture of that virus there. And it's not that family of virus is not something new. It's been there in 2020, in 2012, there was a breakout of an infection called MERS-CoV-2. I don't know whether you guys remember that. And it was caused by a certain type of coronavirus, yeah? And then there was this other SARS-CoV-1 pandemic, which happened in 2002, yeah? But then now what happened when SARS-CoV-2 came, which is the cause of coronavirus in the last 4 years, is that because of certain mutations, it had higher infectivity rate and higher severity of disease, okay? Meaning that the way it was spreading from one person to the next was very pronounced, yeah? And then we started having all these strains of the virus that came up, yeah? And there was Alpha, which was the initial one, and then later on we talked about Delta and Omicron. And mostly it was because this virus kept on mutating, yeah? And I'll talk about it more when I mention the vaccinations. And then we have this thing called the flu virus. So next slide, flu virus. So we have something called influenza. So influenza has been shown to cause flu-like symptoms, okay? It's not the only virus that causes flu-like symptoms, but it's the one that can cause severe illness, okay? So with the influenza virus, it looks like that picture there. And it also has different types. So type A up to type D, okay? But then people have been mentioning, I've been told I have influenza A. Okay, so influenza A is what has been shown to cause flu pandemics across the world, yeah? And including something that was happened in 2009, which was called the avian influenza, whereby you had transmission of a flu from a bird or a chicken into human beings, yeah? It was caused by this influenza virus. And I mention it now because of late there's been a hike in the influenza virus. It's like there's been an outbreak in the last 3 or 4 months, yeah? And this has been triggered by the cold season, yeah? So how do we prevent against these infections? So number one is vaccination, okay? So what's important about vaccination? There are actually vaccines for all the 3 viruses, all the 3 infections I've mentioned. So there's a vaccine for COVID-19. Have we all gotten the vaccine? Yes, at least some of us have. Yeah, and then other ways of preventing infections would be things like cover your cough. So cough into your sleeve, yeah, if you have to cough. And then if you suspect that you're having a flu, okay, or you're having COVID, or you're having flu-like symptoms, you need to stay at home until your results are out, okay? Especially if you're suspecting COVID. You've been tested, you need to stay at home until your results are out. And this also applies to your employees at work. And what happens if you test positive for COVID? You need to stay home. Currently, the guidelines are you need to stay home for 5 days from the start of the symptoms. And then it's important to wear a mask whether you're outdoors or indoors, yeah? And then improved ventilation is also important as a preventive measure from getting infections, yeah? So how do you improve ventilation? Like as you can see, like in this, in our hall here, our windows are open. That's a simple way of improving ventilation. Ideally, another way is if you have an event, it's better to do it outdoors than to do it inside the house. And then in places where you have a lot of AC, people use air conditioning a lot. It's important to change the filters so that to change the filters frequently so that you end up, trapping those virus particles, yeah? And preventing them from just circulating within the area, okay? Washing hands frequently is also a measure that has been taken to prevent infections. What is the recommended way of washing our hands? Okay, how do we wash our hands? Maybe you can demonstrate how we wash our hands. Okay, anyone? Yeah, okay, so, oh yeah, the kids are there, they want to show us how to wash. Oh yeah, okay. Maybe someone at the very back can show us how to wash our hands? I'll mimic what you're doing. So you can show us and then I'll copy what you're doing. That's it. Makes sense? How many steps have we taken? So this, or you are not counting? Okay. So 1, and then wash between our fingers, and then 3, and then, oh sorry, I didn't do this one. Okay, 5, and then 6. If you don't do the 6 steps, then it means your hands are not completely clean. We can do it on this side, someone can show us? All right. Next thing is eat healthy, drink plenty of fluids. Yeah, recommended is minimum of 2 liters in a day. And then management of chronic illnesses is equally important. So identifying, like if you have diabetes or high blood pressure or asthma or any kidney disease, what the recent studies and evidence have shown is that people who have diabetes tend to have more severe illness compared to other people, yeah? So it's very important that if you have any chronic illness, you have it well managed, because when it's well managed, then it means that your risk of getting respiratory infections is equivalent to normal population, yeah? Even infections like HIV, if it's well controlled, then your risk of getting the flu, your risk of getting COVID, your risk of getting pneumonia is equivalent to a normal person. Okay. So why are we talking about vaccination? Vaccination is important because it reduces your risk of getting hospitalized by up to 80%. And it reduces your risk of getting severe disease by up to 60%. Okay? And additional benefits like reduces the chances of death. And the funny thing is that, do you know that the flu can cause death? That just a common cold, we used to call it common cold. A common cold can cause severe illness that requires hospitalization. Yeah? So, last slide. So the CDC, the American Guidelines for Vaccination, recommend that we all get the COVID vaccine. Yeah? There's also a recommendation for the influenza vaccine. So that is something new that maybe people didn't know, that there's an annual flu vaccine that is recommended, okay? And it's recommended that you get it yearly because as the picture of the virus has shown, you always have some mutations happening on an annual basis, yeah? So it's recommended especially for people who are at high risk. And who are the people who are at high risk? Children, people who have chest infections or chronic lung issues require to have flu vaccines every year, okay? And also the elderly, people above the age of 65 require to have a flu vaccine and also a vaccine against pneumonia, which is called a pneumococcal vaccination. There was a question at some point, I think I was asked by somebody, that with all the COVID vaccines that are there, yeah, you have AstraZeneca, you have Moderna, you have Johnson, which one is better? Is one better than the other? Yeah? And the answer to that question is that in our country, we have AstraZeneca. And why do we have AstraZeneca? Because it is stored between -2 to -7 degrees, similar to our vaccines. If you've taken a child to the clinic for vaccination, you know that our vaccines are stored in the fridge, yeah? So they are stored between -2 and -7 degrees or -8 thereabouts, yeah? And that's the temperature that AstraZeneca vaccine is stored in, so that at least it ensures us that our transport, those chains of transportation and whatnot are preserved. But when you look at vaccines like Moderna and Pfizer, these are vaccines that are stored at temperatures of -20 degrees, -70 degrees, meaning they're stored in freezers. Yeah? Meaning that in our country, it might not be possible to transport them or to ensure that those standards are maintained by the time it gets to the consumer, right? But in terms of efficacy, all COVID vaccines are efficacious, and the risks outweigh the benefits outweigh the risks. Yes, the benefits outweigh the risks. Yeah, and that brings me to the end of my presentation. I don't know whether you have any questions. I felt like it would be better to probably talk about things that maybe any questions or concerns that you had around respiratory tract infections. Yeah, if you can bring them up.
Thank you, Doc. Just last week, I watched a video doing rounds suggesting that people who are vaccinated against COVID could suddenly collapse and die. I saw even somebody falling onto a railway track as a train was passing. Are these theories, or is actually true? Because they suggest that vaccination could cause thrombosis, blood clots within the system, and somebody just dies suddenly. Second question, is it possible, is there treatment for viruses, or we just treat symptoms? Thank you.
Good afternoon, Dr. Ari.
Mm-hmm.
Sorry, you can hear me?
Good afternoon, yes. I can hear you.
Yeah, I just want to talk on an issue of when we went for our COVID vaccines and we got AstraZeneca. And my daughter, who has had asthma for a while, it really took her badly. She got now pneumonia. So as I just concur with my brother here, how is it able to, when medics are treating people with these chronic diseases, as you would say, how can they guide that person? Because it really gave her a lot of trouble for a long time. Thank you.
Okay. All right, maybe I can start answering those 3 questions as more questions come in. So first of all, about whether a COVID vaccine can cause, somebody to collapse and die somewhere. Do you know that paracetamol can cause liver failure? Is it preventing us from using paracetamol? No, because sometimes the benefits outweigh the risks, yeah? Meaning that there's a small chance, yeah? And I think the chance was put at 1 in 500,000 patients. So one out of 500,000 people who are vaccinated against COVID, 1 person got a thrombus. Yeah, or 1 person stands a chance of getting a thrombus. Does it negate the fact that out of these 500,000 people that got the vaccine, at least 60% of them, assuming all these 500,000 people got the vaccine, and then 100,000 of them got COVID, yeah? If the chance of getting severe disease, maybe 50,000 of them would have gotten severe disease. The protection, there's a 60% protection, yeah? Meaning that instead of 50,000 of them getting the disease, then only about getting severe illness, not getting the disease, getting severe illness, then you have a 60% protection. Am I making sense? That if out of 10, if 10 people are supposed to, if out of 10 people who got the infection, yeah, only 3 people will get severe illness instead of 10 people getting severe illness, yeah? So sometimes the benefit might outweigh the risk. Does not mean that the risk is not there, yeah? But sometimes the benefit can outweigh the risk. The second question was on symptom control. Yes, so all virus infections are self-limiting, meaning that eventually the illness will stop on its own. And when I say self-limiting, I mean even viruses like hepatitis B. They don't have a treatment. All of them are self-limiting, meaning that eventually your body will fight away the virus and then it clears from your body. So in the meantime, what are you supposed to do? Then you're supposed to control the symptoms. So the symptoms are that a virus will trigger an inflammatory reaction in your body, yeah? So as your body is trying to fight off this virus, your temperature will go up. And temperature is the body's defense mechanism against infections, yeah? So you need to treat the fever that you get, yeah? You need to keep hydrated, because when you're not hydrated, what happens? Your kidneys require blood to get to them so that they work, yeah? And the minute you start getting dehydrated, you're not eating, you're vomiting, then it means that your kidneys can shut down. And what causes people to get severe organ failure or to get admitted in the hospital when they have a flu? It's because of the associated organ damage, not necessarily because of this flu in the body, but also because of the kidney failure that occurs, yeah? Because of the, sometimes it can cause heart arrhythmias, yeah? So sometimes those are the things that cause death when you have a flu. But generally a flu is a self-limiting illness and it should be managed symptomatically, yeah? Yeah. It's just that, as I mentioned before, that COVID or coronavirus, specifically SARS-CoV-2, was unique because it was a disease that really attached to the host cells and really divided rapidly, okay? Triggering such a significant inflammatory reaction of our body trying to fight it off that our body just started to shut down on its own, yeah? About developing signs of an infection after vaccination, sometimes So what possibly could have happened is that probably someone already had the COVID infection at that time. And then we can't rule it out completely, yeah, because there are certain people who are asymptomatic, yeah. There are certain people who had COVID, the infection itself, and they were asymptomatic. So there are a couple of people who get the infection and they don't have symptoms, right? And then at that particular time, then you get the vaccine, okay? And sometimes it can trigger a bad infection, or it can trigger a bad inflammatory response, which then causes a person to get sicker than they were before. That could be one of the theories to explain what could have happened. But again, sometimes with the medicine, you can never really know what happens, yeah? Yeah. Yeah, so I hope that answers the question. Of course, it's not conclusively, yeah, and sometimes getting closure can be difficult because there are so many confounding factors in medicine, yeah. Yeah, some people who have asthma, as I mentioned before, tended to have more severe infection. People who have chronic illnesses tend generally to have more severe infections, more severe inflammatory response to respiratory infections like viral infections. Yeah? Yeah. Any more questions?
Thank you so much, Dr. for the presentation. Mine is just for you to give some bit more insight with regards to the risk factors of taking the vaccines. I know that I remember when I was going for the vaccine, there were some ladies who were there and they were being asked if they were pregnant, and if they were pregnant, they couldn't take the vaccine. So maybe you could touch on that and also just at least highlight some more on the risk factors which are there with regards to taking the vaccine.
Okay. All right then, so as I wait for another question, we can answer that one. Vaccines work because the benefits outweigh the risks. Vaccines are not normally tested on pregnant women, yeah? Meaning that especially at the beginning of, when the vaccines came out initially, there were no studies on pregnant women, yeah? So that's why at that point it was like, should we give the pregnant women or should we not, yeah? And then at the time, especially in the beginning of the COVID pandemic, as I mentioned, the strains, the alpha, beta, Delta, Omicron, yeah, strains. So in the beginning, the virus was not very infective, meaning that pregnant women, a lot of people would get asymptomatic infection. It was mostly people who are getting severe illness were the old people, yeah? That's why the elderly people were the first to be vaccinated, elderly and people with chronic illnesses. But then when the Delta virus came in, it really infected pregnant women, yeah? And that led to a change in the guidelines. Yeah, so suddenly we moved from saying about pregnant women to saying that the benefits in pregnant women, the benefits of getting the vaccine for pregnant women outweighs the risks of getting COVID infection and loss of life, either for the mother or the unborn baby. Yeah, so generally most, even antibiotics, most of them are not tested on pregnant women. Normally, recommendations come after use of the antibiotic, use of the drug on pregnant women, and then later on we'll be like, it looked like children born to these pregnant women tended to have some anomalies. So far, so good. So far, women who've been pregnant and gotten the COVID vaccine in our country, AstraZeneca, their studies still continuing, but they show that there are no adverse outcomes on the babies. So that's why it was included in the guidelines at the onset of the Delta virus, which was around September 2021, thereabouts. Yeah. I hope that answers your question.
Thank you, Daktari. I just had just one more. I think a number of them have been answered. Just one more. Prior to the vaccination, there was emphasis on attempts to boost immunity, either by healthful living, exercise, and all that. And I was wondering, between vaccination and boosted immunity, which one is more effective? And because I also didn't see it in your presentation, so I was wondering whether it was considered ineffective or not. And then secondly, and especially in terms of managing the symptoms, we know that it's an expensive affair with regards to COVID-19 especially. Would it be safe to say that it would be better to encourage, especially the low-income households, to focus more on boosting their immunity and the ways in which they can do that, as opposed to maybe just talking about the vaccine? So I just wanted you to maybe clarify on that issue of boosted immunity. Okay. Thank you.
All right, that's a very interesting question, very good question. And some of these things I didn't include them in my presentation because it's very controversial. So whose immunity do you want to boost? You want to boost the immunity in a patient who is immunosuppressed, right? Yeah? So who is an immunosuppressed person? Immunosuppressed people are taken to be the young, okay? Or the elderly. We say elderly if a patient is above, if a person is above the age of 60, yeah? That would be an immunosuppressed person. And they are immunosuppressed just by virtue of age, yeah? That the immune system has not developed yet sufficiently. That's for children. And for older people, the immune system is not as robust as it used to be when you're young, yeah? Again, immunosuppressed people tend to be people who have diabetes, because diabetes suppresses the immune system. People who have kidney issues, especially like advanced kidney disease progressing towards dialysis, because these are people who are losing their antibodies. The antibodies are the ones that fight infections. So people with kidney disease are losing their antibodies in the urine, okay? So generally, their immunity is low. How do you want to correct? So what about these other guys who are in the middle? Yeah? So these are guys who are in the middle, meaning that people from the ages of 15 up to the age of 60 already have good immunity. Okay? So we used to say, okay, so take fruits. Yeah? Vitamin C. Vitamin C was not shown to, there's no evidence to support the use of vitamin C to boost immunity. Okay? Especially in people who already have good immunity. Yeah? But it's important to keep hydrated. It's important to exercise. Okay? Because exercise improves our metabolism and also keeps our immune system healthy. Yeah? It's sometimes it's important to take vegetables, because vegetables, again, for a person who probably has pre-diabetes, helps with keeping the sugars under control. Yeah? So sometimes, just saying exercise and eating a lot of fruits and a lot of vegetables does not per se improve our immunity by increasing the number of antibodies we have, yeah? But it improves our immunity by keeping our diabetes in check. It improves our immunity by keeping our blood pressure in check. It improves our immunity by improving our metabolism, yeah? So supplements that are supposed to improve immunity would not be helpful for a person who already has, a normal person who eats well. Yeah, that's a normal person who does not have any immune issues. Yeah, but now when it comes to people who have, now like children, that's why children now the flu vaccine would be recommended for them. Yeah, because kids, their immune system has not been developed sufficiently. Therefore, they're at risk of getting recurrent flus. And also, of overcrowding, all those things I've mentioned, yeah? Being in poorly ventilated rooms, yeah? And then children also tend to have really bad asthma, yeah? And sometimes when you have these chronic illnesses and then you get the flu, it puts you down completely. So if you can get a flu vaccine and reduce your chances of getting infection by 30 to 40%, you're not completely eliminating the fact that you'll get an infection, but you're improving the chances of not getting an infection, yeah? Can sometimes be helpful. Again, also recommended for the elderly people, yeah? Because as I mentioned, vaccination. Vaccination is the only way you can truly say that you're doing something to prevent someone from getting an infection. Vaccination and control of chronic illnesses, comorbid conditions. Yeah. Outside of that, yeah. Vitamin C is good. It's tasty. It's okay. Yeah. There's no harm. Yeah. But is it really beneficial? Not so much. Herbal supplements might not be beneficial, but they're definitely harmful because they're increasing these herbal medications or supplements that people take have to be broken down by our liver. Yeah. So you're increasing the load on your liver and causing liver damage. And maybe sometimes already your immune system is sort of struggling when you have an infection. Yeah, you're not eating, meaning that your kidneys are struggling, some other organs are struggling, and then you add a herbal drug, which then also shuts down your liver and just takes you from mild disease to severe disease. Yeah. Yes. So that, I think, brings me to the end of my presentation. So our take-home message is vaccinations are good. Yeah. Booster vaccines are recommended for people who are immunosuppressed, okay, meaning the elderly people and people with chronic illnesses. Eat healthy, okay, not just necessarily to avoid respiratory tract infections, but to keep our immune system healthy and also to keep other chronic illnesses at bay. Drink water, plenty of water. Even when you have a flu or an illness that's putting you down, at least try to take 2 liters of fluids and practice symptom treatment. Okay, so paracetamol when you have a fever. There are some anti-vomiting drugs in the market which can also help with the nausea and vomiting that accompanies respiratory illnesses. Use your inhaler if you're asthmatic. Okay, yeah, and I think that brings me to the end of my talk. Thank you so much for your attention, and thank you for the invitation. I'm truly humbled. Oh, yes. Good question. I think there are some viruses, as I mentioned in the earlier slides, that there are some viruses that skipped from livestock being cows, pigs, chicken, yeah, and their mutations happened in the virus within this livestock, and then the virus was able to infect human beings. However, and then again, in the past, especially before 1980, there used to be a lot of trials on human beings and things like that, yeah? There used to be a lot of trials on human beings, but now since the Helsinki Declaration, there's been a lot of you cannot commit crimes against humanity, yeah, number one. And then number two, also evidence points that the mutations that were seen in this virus, the SARS-CoV-2 virus, it's impossible that these mutations came from livestock, yeah. That there were just spontaneous mutations that happened. And for some reason, the mutations made the virus more infective and made it spread faster from one person to the other, and made it bind to human cells in a more aggressive manner. Yes. And trigger a robust inflammatory response, which caused organ shutdown. Yeah. All right. Thank you so much.